right, good morning, everybody. Welcome. My name is Ryan Bates. I'm the Executive Director at Michigan United. We are the state's largest community organizing group. We represent 100 labor unions, churches, social service agencies, and community groups working for economic and racial justice. I want to thank everybody for joining this briefing. Our members and people all across the state have been deeply impacted by the COVID-19 epidemic and the subsequent economic collapse. This is as everyone knows, the worst unemployment crisis that we've seen since the Great Depression and has happened much more quickly. At the same time, we're trying to support workers and families. We're working with a broken unemployment system. So the goal of today's briefing is to help people, policymakers, understand how we got here, what is the history that created our unemployment insurance system as we know it, and then propose solutions, fixes, best practices that we can learn from that hopefully can become legislation or executive level reforms. Today, we have with us some of our state and country's most knowledgeable experts on the unemployment issue. Rachel Cole is a professor and director at the University of Michigan Workers' Rights Clinic. Peter Ruark as a senior policy analyst for the Michigan League for Public Policy. Michelle Evermore is a senior policy analyst at the National Employment Law Project. And Rod Adams from Detroit Action is here as well to share a perspective on a local solution. This event is open to the press and it is being recorded. The recording will be shared. There will be Q&A towards the end of the call. I do see a couple reporters on. So just be aware this is on the record. I want to thank Representative Robbie, my state representative, for helping to organize and convene legislators and staff today for this incredibly urgent discussion. I know we're all united in our goal of making sure that no Michigander gets left out in the cold due to this crisis, which is certainly not the fault of working people and poor people in our state. Representative Robbie, could you get us started with some framing comments?
Sure, yeah, and thank you so much for hosting this and Michigan United for all of the great work that you do, and to our panelists for being here today. We have a number of state representatives on the line who have joined us, and staff as well from legislative offices. As you all, as panelists probably know already, this is a crisis of epic proportions that we're in. This is about the ability of our constituents to be able to feed their families, to pay their bills, and folks that are waiting 3 and 4 and 5 and 6 weeks, sometimes months, to get benefits and are at wit's end. They don't know what to do. They don't know where to turn. And many of them have turned to our offices. Many of us have hundreds, if not thousands, of outstanding constituent cases that have not been resolved. Our staff are overloaded, they're overworked. They have been only able to focus on unemployment because so many people are coming to us asking for answers. And many of us, I think, feel helpless because we don't have answers. Mm-hmm. But what we're hoping to hear today is, we're all very, very frustrated. I mean, we are as representatives at wit's end. We have no, it is completely messed up that we are in the position that we're in right now. And what we're turning to you to hear is, like Ryan was saying, how did we get here? But more importantly, what can we do to solve this and to make sure that this never, ever happens again? Because again, these are people's lives that are on the line. This is the ability of people to pay for their families and to to feed their families and to to pay their bills. And we just cannot have this ever happen again. And we need to solve the problem right now too, because people are facing this every day. We have people in our that have contacted our offices that still have not gotten benefits weeks later. So I'm really hopeful that this conversation can yield some immediate term solutions and some longer term solutions to fix this for the future. And I'm just really looking forward to the panel, and I encourage all the reps and staff on the line to ask plenty of questions of our panelists as well. So thank you for having this.
Great. Thank you so much for that introduction, Representative Robbie, and thank you for your leadership bringing everyone together. I'm going to turn things over to Michelle, our national expert, who unfortunately has to leave us at 11:30. So we're going to let you go first. Michelle?
Thank you so much, and I appreciate the opportunity to speak to you all today. So from a national perspective, what has happened the past few months was the result of a nationally underfunded and overlooked program and an unprecedented surge in demand combining all at once. No state entered the 2020 COVID-19 pandemic well equipped to process the massive increases in new UI claims that flooded state systems throughout March, April, May, and still coming in June. Administrative funding has been flat for the past 20 years. In 2001, the federal government provided $94.8 million in funding to run Michigan's UI agency. By 2020, that figure barely increased to about $102 million. But if you use the Bureau of Labor Statistics inflation calculator, that 2001 funding level is nearly $140 million in today's dollars. So that represents a significant decline in real funding for the state agency. Since March, however, more than 3 million new claims have been approved. Historically, the highest week of new claims on record nationally was 695,000 for the week ending October 2 in 1982. For the week ending April 4 in Michigan alone, 388,554 new claims were filed. But now more than 3 million, as I said before, workers will be eligible for a benefit, according to the most recent initial claims data. At the same time, a new fraud scheme has infiltrated claims in several states, including Michigan, Washington, Rhode Island, Oklahoma, North Carolina, Florida, Texas. The list goes on. And in order to stop these fraudsters from raiding state trust funds, states have been required to stop payments for anyone who meets certain criteria, holding up benefits for weeks as these truly reprehensible opportunities are weeded out. And this isn't just holding up claims for the honest workers who've been flagged, but it's also holding up all new and backlog claims in all of these states. So that's a real problem. I would say that of all state systems, Michigan's wasn't just neglected, but it was undermined starting in 2011. Benefit recipiency, that's the percent of unemployed workers getting a benefit, fell from 40% immediately preceding the Great Recession to just 26% in 2019. And that's because it was the first state to slash benefit duration and access after the last recession. It went from 26 to 20 weeks. And these cuts have major racial implications. In 2011, when this legislation was passed, the average duration for unemployment for Black and Asian workers was 27 weeks. But for white workers, it was just 19.7 weeks. So when you go from 26 to 20 weeks, that necessarily has a specific racial impact. Another major issue for Michigan and other states is that nationally, the Employment and Training Administration has placed a premium on investigating overpayments rather than paying earned benefits quickly. And so that means that state IT systems, including Michigan's, are designed to hold up benefits that have any potential flag. And, again, Michigan's system was specifically calibrated more than many other state systems to flag and deny benefits. According to the Employment and Training Administration nationally on erroneous denials, the denial error rate for separation reasons in 2017 was 17.44%, but in 2007 was just 8%. So that represents more than double the erroneous denial. And that means that money can't get out quickly in an emergency. And that's a real problem because, this money churns in the local economy. Economists Alan Blinder and Mark Zandi found that every dollar spent in the last recession generated $1.61 in local economic activity. Presumptive eligibility in a state like Michigan, where major communities never recovered from the last recession, is key. And so, you know, Michigan was one of the first states to have pandemic unemployment assistance up and running. It was one of the first states to get the $600 pandemic unemployment compensation up and running. And Michigan has established very compassionate methods of making sure people who qualify for PUA get benefits quickly. That comes as cold comfort to workers who haven't gotten their benefit quickly. And this moment should be a clarion call to workers that we must come together now to make the temporary changes put in place permanent and fight for a better system going forward. And you know, the other people here on the call can get into the details of what went wrong and how to fix it specifically in Michigan.
Great. Thank you, Michelle. I'm going to hand things over to Peter from the Michigan League for Public Policy. Peter is one of our state's foremost experts on how the unemployment system works. Peter? You're on mute. You're muted, Peter, so you're going to need to unmute yourself and restart.
Thank you. Sorry. Yeah, I'm Peter Ruark, Senior Policy Analyst at the Michigan League for Public Policy. As far as foremost experts, I'm going to say that I think Rachel is the foremost expert from Michigan on this call, but I'll do my best, and I may have to defer to her on some of the questions. But yeah, Michigan League for Public Policy is a statewide research and advocacy organization that promotes economic opportunity for all. This current pandemic crisis has resulted in many businesses temporarily closing and a large number of workers needing to collect unemployment insurance in order to continue meeting their needs and putting food on the table. But unfortunately, after the health threat has subsided, after restaurants and schools and fitness centers open back up and social distancing orders are lifted and we all take our masks off, a lot of the businesses will likely remain closed permanently and many workers will continue to be jobless. Federal funding and the governor's executive orders have enabled Michigan to provide UI to more workers and at higher benefit levels, but at some point, the federal funding will run out and the executive orders will expire. But meanwhile, many workers and their families will continue to need the assistance as they look for work. So this COVID-19 crisis shines a bright light on just how inadequate Michigan's UI system has become due to both legislative inaction and the enactment of outright bad policy. And so we're hoping that this legislature will act to fix some things. One example of legislative inaction over the past couple decades, which this legislature can fix, is the unwillingness to raise the maximum weekly UI benefit in a way that keeps up with wages. Michigan last adjusted its maximum benefit in 2002 to $362 per week, where it remains today. That's almost 20 years ago. At the time, $362 was equal to 51% of the average weekly wage, but it is now equal to only 35% of the average weekly wage. So this has been a tremendous erosion in the actual amount of the maximum benefit. So here's the fix that we recommend. For many decades in Michigan, until the mid-1990s, Michigan's maximum benefit was pegged to 58% of the average weekly wage. In this way, UI provided enough assistance to workers relative to their previous wages in order to maintain some level of financial stability and prevent large-scale disruption to their families' well-being. So we urge Michigan's legislature to restore the longtime practice of pegging the maximum weekly benefit to 58% of the average weekly wage. So So no longer just having a numerical amount like 362 and then watching it erode, but in this way the maximum weekly benefit will rise automatically with the average weekly wage, and there is legislation to do that, and we urge the legislature to pass that legislation. Another example of legislative inaction, which this legislature can help fix, is Michigan's hesitancy to adapt the UI system to meet current day employment realities, specifically the fact that an increasing number of Michigan workers are being classified as self-employed or contract workers, despite being under the direction and control of the employer. And this includes, but is not limited to, gig workers, such as those who work for Uber, Lyft, and Handy. These workers are currently covered under the Federal CARES Act legislation, covered for unemployment insurance, but unlike some other states, Michigan does not normally include these workers in its UI coverage. And after the pandemic is over, those workers will go back to not being covered unless this legislature passes legislation that will cover them. Now, some states have adopted what's called an ABC test to determine which workers should be considered employees as opposed to independent or contract workers. I know Senator Hertel has introduced legislation for Michigan to put an ABC test into law, and so I hope that this legislature will support that. That will actually have a lot of benefits other than unemployment insurance, but very important to make for a more inclusive unemployment insurance system. Some unconstructive policies, bad policies. I talked about inaction just now, but there were some downright bad policies. One was the decision in 2011 to shorten the maximum duration of UI benefits from 26 weeks to 20 weeks. Michigan was the first state in the nation to do this, despite the fact that we had the worst unemployment rate in the nation for 4 years during the Great Recession. And just to be clear, not all UI recipients receive the maximum number of weeks of benefits. Some find work before they reach that 20 weeks or 26 weeks, but we want to make sure that there are enough federal or enough state weeks provided, 26 weeks, for those who are having trouble finding work. And then when there is federal emergency unemployment compensation, such as there is with the CARES Act, the fact that we have reduced our weeks proportionately reduces the number of federal weeks available too. So Governor Whitmer has temporarily increased the state maximum to 26 weeks so that we can receive the full number of federal weeks. But after all this is over, we're going to be back down to 20 weeks unless the legislature acts. So that's one example of bad policy. I know my time is running out, so I won't take much more time except to mention right now there's drug testing restrictions where prospective employers actually have control over whether a claimant can collect unemployment insurance. They're not even the claimant's employers, they're just prospective employers, so that needs to be changed. We need to expand the number of workers who are eligible by lowering the threshold so that more lower wage workers can be eligible for UI as well. So thank you, and I'll be happy to answer questions when this is all done.
Great, thank you, Peter. I'm going to hand things over to our state's other foremost expert on the unemployment system, Professor Rachel Cole, who's going to address one issue that I know is frustrating everybody, which is the backlog amongst other pressing issues. Rachel?
Yes, thank you for having me today. My name is Rachel Cole. I'm an attorney, a law professor, and the director of the Workers' Rights Clinic at the University of Michigan Law School. I will give some Michigan-specific overview and outline some of the solutions based on what we have seen on the ground. For over 5 years, the clinic has provided thousands of Michigan workers with advocacy, advice, and assistance to obtain unemployment benefits. Each year, our effort returns over $1 million of benefits back into the community. And as we know, we heard from Michelle, that $1 of unemployment benefits returns back to the community about $1.61 in economic activity, as well as keeping families in their home with food on the table and pulling many families out of poverty. The clinic was also previously part of the 2016 UI working group initiated by former state representatives and now Senators Roger Victory and Ed McBroom, and led by then Representatives Joe Graves and Kevin Hertel in response to the agency's false fraud scandal from 2013 to 2015. I'll go into detail a little bit more about that in a little bit, but that working group produced a bipartisan 8-bill package to respond to the UIA's false fraud scandal. It passed both houses with nearly unanimous support. So normally the clinic receives about 15 or so calls a week, but after the pandemic hit, we started to receive hundreds of calls a day. Typically, we take on about 200 to 300 cases a year, but since the pandemic hit, we have already handled thousands of COVID-related unemployment matters in addition to our already active heavy caseload. Though the volume of these inquiries has exponentially increased, their content is the same as what we've seen for years. Many of you may have heard the following now. I was denied and I don't know why. I applied weeks ago and I'm still waiting. I'm being denied because of a previous job, but I'm not applying due to that job. I've called and I've emailed and I just can't reach anyone at the agency. Claimants across Michigan have called us about these same issues and we have been on the ground fighting for them for years. These struggles are nothing new for us, but merely amplified by the amount of people applying all at once. Over the last 5 years, the Workers' Rights Clinic has experienced firsthand how hard it is to communicate with the agency. Prior to the fall of 2019, our clinic was almost never able to connect with the agency on the phone. The agency's challenges with communication have been extensively documented by the state. The Senate Oversight Committee reviewed the Auditor General's report, and in 2016, it found that the UIA didn't answer 89% of its calls. And that's when the agency was only getting 5,000 to 7,000 calls a day. Now during COVID, they're getting 200,000 calls a day. The agency upgraded its phone in the fall of 2019, and after that, things greatly improved. For the first time ever, we suddenly were getting through most of the time with a wait time less than 10 minutes. This was the best we'd ever see the UIA function. And so we sent a letter, Claimant Advocate Group sent a letter to the governor yesterday to highlight the success of this current UIA leadership team. But recognize that COVID hit, and the agency went from having to answer 7,000 calls a day to 200,000 calls a day overnight. In 2013, the state programmed a new computer system called MIDAS to halt benefits at every possible turn. And part of that programming then forces claimants to call the agency to fix their issue. But when the agency wasn't answering 89% of its calls in 2013, 2014, 2015, 2016, and so on, how many of those people actually got their benefits? Like I said, claimant advocates like me know the issues that Michiganders are facing now are nothing new, but fortunately, the attention is on them today. And if any of your constituents have been denied benefits or if their claim is still under review, chances are the statute and the implementation of MIDAS in 2013 caused or aggravated the issue. Prior to these changes, Michigan was in the mid-range for unemployment recipiency in the country, but today we are one of the worst recipiency rates, and we have one of the worst recipiency rates in the country. A statutory solution is required for statutory problem, and the clinic has a memo that we submitted to the Joint Select Committee that outlines specific changes we recommend based on our experience representing claimants. I asked to testify before the Joint Select Committee to describe these issues, and while I waited to testify, I heard from other claimants who had been denied or held up in the UIA system. And from their stories, I saw the reason that they were not getting benefits was not the agency's fault, it was the statutes. The agency has to operate under the laws that the legislature passed. For example, one man testified that he was being held up and he didn't understand that his benefits were being held up, and he didn't understand why the job he recently retired from was showing up on the account, because that's not why he was filing for unemployment. But that's because the statute forces the agency to consider every employer in the claimant's base period. And even more confusing, the law considers his retirement a voluntary quit, which disqualifies him from benefits, even though that man is unemployed now due to a layoff from a different job. Michigan's current law cuts him out. Another woman testified that even though she worked 2 part-time jobs, she didn't earn enough to qualify for state benefits. Well, that's because Michigan has one of the most restrictive monetary thresholds to even qualify for benefits in the whole country. The only reason this young woman could get benefits now was because of the temporary relief of the Federal CARES Act. But a Michigan statute also wouldn't find her eligible for benefits because she's a part-time worker. Michigan's one of the only states in the entire country that doesn't cover part-time workers. But this young woman was not going to qualify for either state or federal benefits because she lost only one of her jobs. She was still working at Target and earning wages, albeit much less than she was earning before. But the law requires that the agency use those earnings from Target to reduce or completely eliminate any weekly unemployment benefit. And it's important to know that the agency is following the rules that the legislature has put in place when it held up and denied these specific people. These constituents' issues are statutory issues and requires a legislative fix. And again, my memo will outline some ideas to fix these things. But magnifying these issues from the statute is the MIDAS system that was implemented in 2013. This was a system designed to auto-adjudicate every claim without human oversight. It cost taxpayers $47 million, and it led to one of the worst scandals in Michigan's history, right up there with the Flint water crisis. Its design led to over 60,000 wrongful determinations of fraud to innocent Michiganders at a 93% error rate. Significantly, you've been hearing about notifications like non-monetary issue, additional claim required, stop payment indicator. Those are all MIDAS flags. And these flags halt payment immediately and unnecessarily and burdens the claimant to fix it. Otherwise, they won't receive benefits. And these are the same flags holding up claims now. This is what's causing the backlog. The system is meant to flag all possible issues and halt benefits, supposedly built with codes designed for Michigan's restrictive statute. However, the programmers overcalibrated these flags, which continue to erroneously deny benefits ever since 2013. And now the pandemic's sheer number of people trying to obtain benefits is finally holding up a magnifying glass to MIDAS's faulty programming for all of these claims. Since 2013, claimant advocates like the Workers' Rights Clinic have seen some of those flags even deny people where the statute permits. Troubling, the faulty coding has gone unchecked by the public, the state, the legislature since its implementation in 2013. There's been no data or review of the system, apart from the agency's own admission of a 93% error rate. The system is not set up also for any claimant error or employer error. We saw from federal data that erroneous denials caused by claimants making mistakes in the system rose from 11.62% in 2002, before MIDAS, to 81.07% in 2017. Between the website being hard to navigate and the claimant's dramatic increase in erroneous denials, we see that MIDAS is not working for the people of Michigan. Legislators, I know you're here to find solutions. And given the longstanding nature of these issues, there's no quick fix. But there are ways that we can change the statute to help. We can update the statute to cover Michigan's workforce. We should review the austerity measures from 2011 to review its impact on Michigan workers. We can have a more reasonable monetary threshold that puts us back in line with the rest of the country so that people that have lower earnings can still qualify for benefits when they lose their job. We can cover part-time workers. We can change the law so that the job not causing the current unemployment doesn't prevent access to benefits. We can cut this red tape, and in turn, we can cut the MIDAS flags so that people who are involuntarily out of work can have necessary support. And also, the legislature should pass a law to require state automated programs like MIDAS to be subject to review from experts, to publish their logic formulas and require that those programs go through rigorous and frequent reviews to ensure that the state is only cutting out who it is supposed to and no one more. These reports should be made public. MIDAS has never gone through this kind of review, and it's been a travesty to the workers of this state since 2013. The moral of the story is that the UI system, the issues in the UI system have existed long before this pandemic. The clinic has been seeing these issues for years. And because so much of the state's unemployed all at once, we can really see how many people the restrictive statute and the MIDAS programming are cutting out. I'm hopeful that the legislature is aware of these problems now and will fix them. I'm also hopeful that they will use assets like the Workers' Rights Clinic and the Michigan League for Public Policy. Our on-the-ground experience with the UI system will be an asset to the legislature, and the Workers' Rights Clinic will be happy to be there however we can to create a better UI system for the people of this great state. Thank you.
Thank you, Rachel. And I want to point something out. Professor Cole was invited to speak before the Select Committee, and how many hours did you wait to be able to testify, Professor?
I waited about over 9 hours over a couple of days, and I was able to speak. I just wasn't able to give my testimony on the record. I was able to answer questions.
So, we want to thank legislators for attending this briefing. so that you have the benefit of Professor Cole's experience, which she has been unable to provide in another forum. I'm going to see if I can summarize some of what you're saying, Rachel, and then I'm going to hand things over to Rod. It sounds like there are 3 or 4 kind of areas we need to focus on for addressing the one, the backlog, and that seems like we need more money to hire more people to answer and review claims. It's a system that went from handling 7,000 calls a day to 200,000. So you just need to be able to scale that more broadly. 2 is the actual statutes about who's eligible are just too restrictive and are more restrictive than they are in most other states. So that's something that the legislature could fix. These issues you mentioned around part-time work, a very low earnings threshold, the voluntary quit disqualifying, and many of those others. And then there's this other question of the implementation of the MIDAS system itself, which is more restrictive than even our very restrictive laws themselves. So MIDAS either needs to be wholly reviewed and reprogrammed to actually reflect our laws rather than being more restrictive than our laws are, or maybe we need a new system. Am I summarizing that well, Professor?
Yeah, I think the one thing that I would clarify though is that the state has received more funding to hire more people, but to understand unemployment's super complicated. It's unnecessarily complicated, but because of that, the amount of time it takes to train all these new workers is going to take up to 6 to 8 weeks. So while they have hired more people, it takes a long time to get them up to speed to be able to handle some of the more complex issues.
Great, so there's a lag there. Thank you, Professor. Before we open it up for questions, I believe we have Rod Adams from Detroit Action here, who's going to discuss a grassroots solution that we hope the legislature is able to support. Rod, are you with us? Okay, I don't think we have Rod. Then in that case, we're going to move to Q&A. So if you have questions for Rachel and Peter about how we can fix the system, now is the time. Be sure to take yourself off mute, or else you'll be giving an eloquent speech to no one.
Sorry, I'm Jamie Sherrod from TV5. I initially had the wrong link, so I probably missed some things here. I just had a question about how and why do you guys believe the system is designed to deny workers their claims beginning in 2013?
So the reason why is because of the MIDAS program. MIDAS was a computer software program. It was supposed to update the state system, but it was designed really to create, if there was any possible issue, we're going to put a flag which would immediately halt benefits. And then for most of those flags, the agency, the claimant actually has to call in to the agency to fix it. And the flags are also they're completely incomprehensible to claimants. The flags are non-monetary eligibility. They are additional claim required. They are stop payment indicator. I don't know anybody who would know what that means if they saw that on their account. But the programmer knows what they mean. But there's no way for a claimant to know what they're supposed to do in response to those indicators. So it's a mixture between the program being over-calibrated to flag and deny. And they also, from experience on the ground, there are even parts of the statute where the statute actually allows these people to get benefits. And a good example is part-time workers or someone who quits a part-time job to continue with their full-time job. I have never seen the agency adjudicate that appropriately. So the statute says if you quit a part-time job, but you're continuing with your full-time job, you're not going to be disqualified because of that quit, the part-time job quit. But yet I have litigated multiple cases because the agency has denied them, because Midas has flagged them. Because normally if you quit, the Midas has it programmed, if you quit, you don't get benefits. So there's a lot of issues with the way it was programmed. I don't know how it was programmed. No one does, and that's the problem.
So the one point I'll make is the question of why it is like this. And my understanding is that the Snyder administration purposefully sought out a system that would deny more claims. And in fact, the company that produces Midas advertised this as a system that would reduce the number of people who are getting unemployment. So it was a policy decision by the Snyder administration. They wanted fewer people to get unemployment benefits, so they chose an extremely restrictive system and programmed it to deny people claims.
And
So
there's
now,
part of my, oh, sorry,
please go
Ryan.
ahead, Rachel.
The packet that I submitted to the Joint Select Committee, I included a letter from Fast Enterprises, was the company that designed Midas, that basically just says everything Ryan just said.
Okay, and ma'am, what was your name again?
My name's Rachel Cole. I direct
Okay.
the Workers' Rights Clinic at the University of Michigan Law School.
Okay, and sir, the one that was also just speaking to me, what was your name and title?
Sure, I'm Brian Bates. I'm the executive director at Michigan United.
Okay, thank you.
Great. Are there other questions?
Yeah. This is Tracy Samilton with Michigan Radio. So we had this issue of all those claims from the system, people being accused of fraud, but we still have the same system. So have those accusations of fraud been continuing as well?
So yes and no. The state reached a settlement in 2017 to go back and review all of the cases during that time. And then part of the biggest change that happened after 2015, when this was exposed, and actually the false fraud scandal was exposed by current UIA director Steve Gray to the federal government and to the state. But when the biggest change that happened after 2015 was that it was all done by computer before then. No human even looked at it or touched it. That was the false fraud scandal from 2013 to 2015. After it was exposed, they put humans to review the claims, and since then there has been significantly fewer fraud charges. However, I will say that both the prior Attorney General's office and the current Attorney General's office continue to prosecute cases that my clinic has won, where there's been proof of no fraud given at, like, we won the case at the hearing. And even this, as recent as this month, the state has appealed a positive case where we won finding no fraud for during this false fraud time frame, where the state admitted that they were wrong 93% of the time, and they produced no evidence of fraud. So while there hasn't been new false fraud charges, the state is still actively prosecuting them.
Does that answer your question, Tracy?
Yes, thanks.
Right. I know we have a number of members of the legislature and their staffs on the line. Is there anyone from the legislature or the legislative staff who'd like to ask a question? I want to make sure you guys get in there. Okay.
While we wait for them to jump in, my name is Kimberly Craig from Channel 7 here in Detroit. And if I could ask Professor Cole, the example that you gave of the woman from Target who had the 2 part-time jobs, she was laid off from one. She should have qualified, if I understood you correctly, for unemployment, including the federal edition of the $600 a week, for losing the 1 part-time job, but still maintaining her Target job. Is that correct?
She did qualify for the PUA program, the federal part of the Federal CARES Act. However, the problem is that everybody who qualifies for the federal program also has to, the state's eligibility requirements can reduce or eliminate their access to benefits. And so because she still had earnings at Target, even though they were a lot less than she was normally making, even though she still had those earnings, those earnings completely reduced or eliminated her benefits, because that's just part of the way Michigan has the law is if you have earnings, it's going to reduce or eliminate your access to benefits for the weeks you have earnings.
Okay, so she qualified for PUA, but she did not get it because she did not qualify on the for the state unemployment.
Exactly.
Thank you, Professor. Other questions?
Hi, yes, my name is Kieta from State Representative Tisha Yancey's office. I just had a quick question, however, I'm uncertain if that question can be answered here. So in previous experience with the Unemployment Insurance Agency, when stop indicator payments have been issued, how long was the expectation set for constituents to go ahead and have maybe a solution? Granted, I know we're in the midst of COVID, so this may not necessarily be slightly as, quickly responded to, but is there any type of guidance for that? I think that's a large battle that a lot of our offices are seeing as of right now.
So I'm not sure if I fully understand your question, but generally the Department of Labor has guidance that it should take 21 days to review and pay out benefits. But if we review how the agency has done that for years, we have been longer than 21 days consistently for years, decades.
Thank you.
Other questions?
Hi, Rachel. This is Cynthia Paul with House Democratic Policy Staff. I think what the individual was saying previously is because of the potential fraud, there's been a lot of stop payments. And is there any expectation about how long that will take after they submit the new identification documents for the unemployment agency to start resuming the benefits?
Yeah, so I don't know the answer to that exactly. What I do know is that the agency is going to try to do it as fast as possible. And the only reason I have any faith at all in the agency whatsoever is that the person who exposed the agency's past bad actions, Steve Gray, is at the helm. That's so if they're going to get paid out fast, it's going to be because of him, and he's going to do his best to get it out. But as for your constituents, to tell them though, they should be sure to save the state's number in their phone, because part of what the agency is doing is that they've directed a bunch of people to call and verify people's identities, and they need to pick up that call.
Yeah, so that's a very important public education thing we should all be doing for our constituents, preparing them to verify their identity if they've applied.
And if they can verify their identity by submitting their information on MyWAM and include their specific letter ID number that they got in the mail, that will get it done a lot faster.
It looks like there's some questions in the comment section. I saw there's a question from Rep. Hood. I don't know if she wants to ask her question or if the panelists want to just read the question and try to answer it.
Thanks, Rep. Robbie. I did get an answer that, and my question was simply what states are doing the best work in terms of qualifying gig workers or individuals with non-traditional employment histories. I received a response that California has done a good job with this. I would be curious if there are other states to add to that list.
I am currently working on a 50-state review of what states have done, and also what they've done in response to COVID, and also what they've done even before COVID. And it's going to take me a little bit to finalize that, because we are a bit swamped with all the hundreds of callers we're getting a day. But I'm happy to get that over to you when we have it done.
I'm sure all of all of the legislators would appreciate seeing that analysis. Thank you.
And all of the
Yeah, could I
materials-
also say that the National Employment Law Project has put together a really good paper on that.
And all of the materials that are referenced, Peter and Rachel's and Michelle's comments, the memos that they've put together, we'll be packaging together for Representative Robbie, who can pass them along to legislators. We have a little bit of time, but I'd like to point out that we do have a working group of community organizations and legislators who are working together on addressing these issues. Representative Lisinski and Representative Sabo have also worked with us to publicize some of these issues, particularly expanding and extending unemployment. So I'm going to put my email along with Rachel and Peter's contact information into the chat. So if there are legislators who are interested in follow-up conversation or being part of a working group to put together legislation based on Rachel and Peter's recommendations, please contact us and we can do the follow-up with you to take some of the important ideas that have been laid out here and turn them into bills.
Ryan?
Yeah,
Ryan?
go ahead, Cynthia.
This is Cynthia Paul with House Democratic Policy Staff. I've been actually working with Representative Sabo on a second package of bills that takes care of, not all of them, but a lot of the questions and issues that were brought up by Peter as well as Rachel.
Great.
And hopefully they'll be introduced this coming week.
So if you're a legislator, I'm sure you know Cynthia, so you can follow up with her to figure out the status of that round 2 package. If you're interested in working with the advocates who are meeting weekly to advance these things and build public support, please contact us. Our meetings are Fridays at 4, which is a great time for people to attend. Any other questions for Rachel or Peter?
I've got one actually. Oh, unless somebody else. Rachel, this was a question for you actually, since your clinic deals, daily with folks that are having issues with unemployment. And I feel like in some ways, we now have 110 offices in the state house and 38 offices in the state senate that are doing, frankly we have been dealing with unemployment cases on a basically daily or weekly basis even before this crisis in our offices. Our staff are, they a lot of them know the system and are trying to work through it. But we're all dealing with this now, and I feel like you're kind of in a similar boat as many of our offices are. And the questions come up multiple times to me of like, what do you tell people? Because people are coming to you for help and they don't know where to turn. And finally they get somebody on the phone because our offices actually pick the phone up and, or call people back, answer their emails. And people have questions, they are concerned, they're afraid, they're scared for what's going to happen in their future. And, these are our constituents, these are our people in our districts. And what do you say to people when they call your office and what do you say to people?
Yeah, and that's, that's a good question. And we do our best to be empathetic. We have been seeing these issues for years. And so one of the benefits that our clinic has, I think, over some of the representatives and senators' offices is just that when claimants send us screenshots of their certification tab and their determination tab, we have a decent idea about what's going on based on our experience. And so we usually are able to give some type of response to help and help to move things forward. That said, I will also say that we have a backlog too. Normally we would try to respond within 24 to 48 hours, and sometimes we are having to be closer to a week or 2 weeks to get back to people in time. And And we found that actually most of the time when we get back to them in that amount of time, the agency has fixed the issue. That's not everybody, but that's a majority of the people if we had that long delay. So hopefully the agency will fix their issue. I know that they're working tirelessly to try to do so, but yeah, like I said, the best thing that we have at our disposal is just kind of the general knowledge about how the system works so that we can try to figure out what's wrong with their specific claim. And we're happy to help any of your offices if you've got some weird ones. I love the weird ones. So send them my way.
Great. Thank you, Professor. And we have time for, there was a question about which bills have already been proposed. So Peter and I threw into the chat a number of bills that have already been introduced. So folks can co-sponsor those or inveigh upon your Republican colleagues to give them a hearing. So you can look there for policy that's already going on. I see a hand up from a representative whose full name I cannot see.
Hi, this is Rep. Stone.
Please go ahead.
So my question is about unemployment department staffing. So one of the problems is not having enough people to adjudicate all these cases that need people with their eyes on them to clear them. And then we have an additional glut of cases with people that need to verify identifications. Any suggestions on recommendations? I mean, we've gone so far as to say we'll volunteer ourselves and our staff to come and work to do anything to expedite this. Any suggestions?
Yeah, I think the hardest part about this is that the unemployment system is complicated. The MyWAM system is complicated. The MIDAS system is complicated. There's a lot of nitty-gritty laws. So getting trained on this stuff, it's not like you can just pull people off the street to come help, even though that would be great. I think the biggest issue is the fact that we designed MIDAS to be something that halts and denies benefits rather than allows benefits to go through. There are too many flags, and there are too many flags that cause issues. And for a lot of these flags, these are flags that shouldn't be there. And if we were able to remove those flags, then we would not be seeing the gravity of this issue right now, because automation is not necessarily a bad thing. It's all about how you design the program. And if we were able to fix how we automate, then we would have less in the backlog.
Thank you, Rachel. Representative Stone, does that answer your question?
Yes, thank you.
Great. I think we have time for just one or two more questions before we're at the hour.
Hi, this is Mario Arribas from State Rep Robert Wittenberg's office.
Please go ahead.
First of all, thank you for the presentation. I just have one question for you. So it seems clear to me after the presentation that MIDAS is a big part of this problem. So I'm wondering if you're aware of any other system in place in another state that's more effective, and if an overhaul of this MIDAS system and transition to a new system is something the legislature should consider and potentially implement.
So I don't think an overhaul is necessary. I think a review of it and maybe a review of the programming and fixing of the programming, but the system itself is not necessarily inherently bad. The system itself is also, like, the reason that we are able to be one of the first states or the best states to pay out the federal plan, like the PUA, and getting the $600 out and to develop these extra federal programs, as well as processing 92% of the claims, one of the fastest in the entire country, is because of MIDAS. So I don't think a complete overhauls what needs to happen. I think it needs to be reviewed, and I think it needs to be subject to continuous reviews. And I think that's where the legislature should focus. It's what it should do. It should require not only MIDAS, but any state automated system to be subject to reviews, to have to publish their logic models, and so that we can test and make sure that the state is cutting out who was supposed to and no one more.
Great, thank you.
We have time for one more question. Okay, with that, if there are no more questions, I want to thank Michelle Evermore, Professor Rachel Cole, and Peter Ruark for sharing their expertise, and Representative Robbie for bringing us all together. Please drop off a lawn sign on my lawn as soon as you can. I
Will do.
really want to encourage legislators who want to work on these issues, who want to be public about these issues, who want to put together a coalition that can make some of these deep structural changes that Rachel and Peter have laid out, to please get